Hello everyone, I'm Dr. Varni Koskallana here with a simplified anatomy lesson for you. In this video, we will be discussing about the blood supply of the large intestine along with some important clinical correlations. The large intestine consists of the colon and the rectum. From proximal to distal, the colon consists of the cecum, right or ascending colon, hepatic flexure, transverse colon, splenic flexure, left or descending colon, and the sigmoid colon ending at the rectum. The colon is divided into two parts depending on its embryological origin. The proximal section extends up to the proximal two-thirds of the transverse colon. The proximal section is derived from the embryological midgut, while the distal section is derived from the hindgut. The proximal section usually receives its blood supply from the superior mesenteric artery, arising at the first lumbar vertebral level. It gives the middle colic artery to the transverse colon, the right colic artery to the right colon, and the ileocolic artery, which gives an ascending branch to supply the right colon, an appendicular branch to the appendix, anterior and posterior branches to the cecum, and an ileal branch to the ileum. It also has other branches to the ileum as well as the jejunum. The distal section is supplied by the inferior mesenteric artery arising at the third lumbar vertebral level. It gives the left colic artery to the left colon, 2 to 4 sigmoidal arteries to the sigmoid colon, and continues as the superior rectal artery to the rectum. The ascending branch of the ileocolic artery, descending and ascending branches of the right colic artery, right and left branches of the middle colic artery, ascending and descending branches of the left colic artery, and ascending branches of the sigmoidal arteries form an anastomosis at the inner or the mesenteric margin of the colon. This is called the marginal artery of Drummond. In cases where the blood supply may be compromised to the colon through these arteries, the marginal artery of Drummond can compensate. There are weak areas of the anastomosis. One of them is the Griffith's point at the splenic flexure. It forms the margin between the supplies of the superior mesenteric artery and the inferior mesenteric artery. This area is reinforced by another anastomosis called the arc of Riolan, found between the left colic artery and the left branch of the middle colic artery. Another watershed area is the Sudeck's point, between the supplies of the sigmoidal arteries and the superior rectal artery. The middle colic artery goes through the transverse mesocolon to supply the transverse colon. The middle colic artery is situated a little bit towards the right side. Therefore, there is an avascular area within the transverse mesocolon which can be used for surgical access into the lesser sac. Here we see the blood supply of the rectum. The rectum receives blood supply from the superior rectal artery, which is the continuation of the inferior mesenteric artery. It also receives blood supply from the median sacral artery, which arises from the bifurcation of the aorta. It also receives blood supply from the middle rectal artery, which arises from the anterior division of the internal iliac artery, and the inferior rectal artery, which arises from the internal pudendal artery, also arising from the anterior division of the internal iliac artery. When we look at the venous drainage, the draining veins correspond to the arterial branches. We have the ileocolic vein, right colic vein, and middle colic vein draining into the superior mesenteric vein. And from the distal colon, we have the superior rectal vein, sigmoidal veins, left colic vein draining into the inferior mesenteric vein, which drains to the splenic vein. The splenic vein and the superior mesenteric vein form the portal vein, which drains into the liver. Therefore, the liver is a frequent site of secondary deposits in colorectal cancer through this venous pathway. Here we see the venous drainage of the anorectal region. We have the superior rectal vein draining into the portal venous system through the inferior mesenteric vein. We also have the middle rectal vein draining through the anterior division of the internal iliac vein, and the inferior rectal vein which drains into the internal pudendal vein and then to the internal iliac vein. This drains into the common iliac vein and the inferior vena cava. Here we have a site of portosystemic anastomosis, where the portal venous system meets with the systemic venous system. In case of portal hypertension, which occurs in conditions such as cirrhosis of the liver, there will be venous congestion in this area, which will lead to anorectal varices, which are dilated veins. So in summary, we learned about the arterial supply of the colon and the rectum, the venous drainage of the colon and the rectum, and some important clinical points about anastomosis, watershed areas, avascular access in surgery through the transverse mesocolon, liver metastasis in colorectal cancer, and varices at the anorectal junction in portal hypertension.